feeling good about eating chips. So you guys are enjoying your chips. You are going to take us on your latest finds across the web here. What do you got for us this time?
Well, we have a couple of self-help websites, starting with revolutionhealth.com. Because, you know, the internet can really empower you, revolutionize the way you manage your own health and your loved ones, whether it's an aging parent or a child. Now, when it comes to health websites, needless to say, sources matter, right? We don't want to mess around.
Yeah, you got to be careful. I mean, you can't, you know, just go to willcureyouhere.com.
Good point.
And start doing, you know.
So revolutionhealth.com has sources like Mayo Clinic. Big difference than willcureyou.com.
Mayo Clinic, I trust.
Right. And one
Not so much the Mayo on the sandwiches, but the Mayo Clinic. Good.
Yeah, exactly. Exactly right. Good distinction. And the other reason that these sites are increasingly valuable is when you go to the doctor's office now, you may get a matter of minutes. That time is shrinking, and you want to use it well. So the more informed you are on the way in, the more informed your questions will be.
That's clever, actually. You can go to the site for what you think ails you, and then it'll help you present to your doctor what you really need and want to know.
Yeah, with one caveat. It doesn't make you a doctor, and you don't want to self-diagnose and then have them spend the entire time talking you out of what you've talked yourself into. Having said that, it also prevents that nagging feeling on the way home from the doctor's office. I wish I had asked this. I should have asked that.
So we have a mom here, actually, that has a sick kid at home. So what are you doing here? No, just kidding. Kidding. Seriously, your child is not feeling well at home?
It's not that I don't know if he's sick, but I noticed that he gets this, like, he's 10 months old. He started eating food.
Itty-bitty.
He's itty, well, he's
itty-bitty.
Itty-bitty. And he gets this, like, orange, patchy, dry cheeks and nose. And I was just wondering maybe if it's, like, a food allergy. It's something he's just starting to eat food.
Yeah, that's a good one.
Or I don't know what
example. Not a crisis situation. Nobody's bleeding.
He's not really sick. He just gets rosy cheeks.
And you're
orangey.
Yeah,
You're
right?
Orange is my favorite color.
I believe Harrison is his name, right?
Harrison.
All right, so let's say we got Harrison at home. I'm sure he's adorable. We got the orange cheeks going on.
Everybody looks good in orange.
But not on the cheeks. Come on. So now we're going straight down here. By way of example, we're going to click on something called the Symptom Checker, right? Pretty intuitive. Boom. Here we go. Step 1, you see on the right-hand side, child symptoms. All right, we're going to go down to skin rashes, right? That sounds Harrison-like. Okay, so it gives us...
Itchy or scaly?
Scaly.
Scaly. He's a scaly.
All right, so we click scaly. See? Exactly. I mean, they have the description.
This is kind of fun.
So now we go down to...
Oh, affects cheeks.
Nice. Good listening, Rachel. I'm very impressed. You could be a PA.
Does it follow him eating certain foods?
Yes, right? You're a nurse.
I love this
Cooking thing. Okay, so now accompanied by red cheeks, right? We'll call it red cheeks?
Yes.
Okay. So
yeah, they don't have orange, sorry.
Yeah, orange wasn't an option. Close enough. So now we submit this. It searches a database, right? And it's going to come back with step 3, potential results. Now, again, this doesn't make us a doctor or you a nurse. However,
it doesn't mean little Harrison has any of this.
Correct, and you don't want to self-diagnose. Well, he probably doesn't have that yet. But
dermatitis, that doesn't sound so bad.
All right, so we don't panic now. We start to say which one has the most patches. Maybe that's my scenario. Let's click on this by way of example. Again, I'm not self-diagnosing, but I'm reading this. I'm a little bit more informed. When the doctor starts talking, you know, and you're worried about your child, you're not.
Right.
You know, sometimes you don't even hear it because you're so worried about your child, and you're like, oh, what did he say? Or I should have asked this, I should have asked that. So great on the way in. Also on the back end, once you get the diagnosis and you go home, you can talk to other moms, compare notes. Did you switch from carrots to beans? Support groups if that's useful to you, and tracking. So if it's something that he's going to have to deal with over time, you can say, how are we doing? And that adds value as he grows up.
In conjunction with working with your physician.
Exactly right.
Cool. Of course, we're going to have links to all this on our website. Take it wherever Regina's taking us today. Now, from the doctor's office is something else a lot of people dread as much as going to the doctor shopping for a car. What do you got in that category?
Oh, boy. Second biggest purchase for most people. Women, every survey says, pretty much dread it. So many choices, so many price points. Where does a girl begin?